Hello guys, now we are going to see about deafness in the first unit of medical surgical nursing. Deafness and hearing loss we are going to see. Deafness. Deafness is nothing but unable to hear. Okay, unable to hear. That is called as hearing loss. Hearing is one of our primary mode of communication, right? When we will hear only, we will respond. So, hearing is one of our primary modes of communication. 360 million people in the worldwide having a disabling hearing loss. Hearing loss may result from genetic causes, complications at birth, certain infectious disease, chronic ear infection, and the use of particular drugs, exposure to the excessive noise and aging. These are some of the causes for hearing loss. Loss of hearing either temporary or permanent. Okay, the loss of hearing may be either temporary or permanent. A person who is not able to hear as well as someone with a normal hearing, that is hearing threshold of 25 decibels or better in both the ears, is said to have a hearing loss. Okay, if the person who is not able to hear, if the person who is not able to hear, it may be both the ears or any one ear, then we will call it as a hearing loss. Normally, we will hear the threshold of 25 decibels. But the person those are having a hearing loss, even the high decibels also, they will not able to listen. They will not able to hear. That is called as hearing loss. The hearing loss may be mild, moderate or severe or profound. Mild, moderate, severe or profound. It can affect one ear or else both the ears. When the person is having a hearing loss, the person will be having a conversational speech difficulties. And next, moving on to the incidence, hearing impairment has been reported to occur in 3 of every 1,000 births. Okay, for every 1,000 births, three persons will be having a hearing loss or hearing impairment. Causes for the hearing loss and deafness. What will be the causes means? The causes for hearing loss and deafness are congenital causes and acquired causes. See, a lot of difference will be there in the hearings and deafness. Hearing loss and deafness. Deafness is nothing but complete absence of hearing sensation. But in case of hearing loss, the hearing loss may be mild, moderate, severe and profound stages will be there. But in the deafness, a complete absence of hearing will be there. That is called as deafness. So, what will be the causes for this means? The causes will be the congenital or else acquired. Congenital causes. Okay, the congenital causes may lead to hearing loss being present or acquired soon after the birth. Hearing loss can caused by hereditary or non-hereditary genetic factor, or else due to the complication during a pregnancy and childbirth. Okay, what will be the complication during a pregnancy and childbirth means like maternal rubella, syphilis and certain other infection during a pregnancy. If the mother is having a infections like maternal rubella, syphilis or certain other infections during a pregnancy, that may causes a hearing loss in the child. The low birth weight baby, birth asphyxia, inappropriate use of particular drugs during a pregnancy such as aminoglycosides, cytotoxic drugs, antimalarial drugs and diuretics. these drugs will be having an adverse effect over the child growth and causes a hearing loss. Next, severe jaundice in the neonatal period, which can damage to the hearing nerve in the newborn infant. These are the congenital causes. Next, moving on to the acquired causes. The acquired causes includes infectious disease including like meningitis, measles, mumps, etc. A chronic ear infection, collection of the fluid in the ear, that is otitis media, use of certain medicines such as malarial drugs, drug resistant tuberculosis and cancer drugs, injury to the head or ear, excessive noise including occupational noise, recreational exposure to the loud sound, and aging is also one of the acquired cause. Aging will lead to a degeneration of sensory cells, and wax or foreign bodies that blocks the ear canal. And among the children, a chronic otitis media is a common cause for the hearing loss. These are the acquired causes. Next, moving on to the types. Mainly, there are three types of hearing loss, that is conductive hearing loss, we will call it as a CHL, sensorineural hearing loss, SHL, and mixed hearing loss. We will see one by one, that is conductive hearing loss. Conductive hearing loss can be result of blockage in the external ear canal. When there is a blockage in the external ear canal, that will cause us a conductive hearing loss, because when there is a blockage in the external ear canal, the sound waves will not passes to the middle ear, okay, and inner ear. So when the sound waves are not able to transmit, then it will cause us the hearing loss. When there will be a passage of sound waves to the stapes foot plate only, we will listen, we can able to hear. When the conductive system of the sound failed, when the external ear canal blocked, so it will leads to a not able to pass the sound waves to the stapes foot plate. So only there will be a hearing loss will takes place. So how the external auditory canal will blocks means because of a wax infection or a foreign bodies in the external auditory canal. Next, moving on to the what will be the causes for the external, other causes for the external auditory canal blocking means infection like otitis media and meningitis, tympanosclerosis, it is caused by result of repeated infection and trauma to the tympanic membrane, and trauma to the tympanic membrane. Next, moving on to the sensorineural hearing loss, SHL, sensorineural hearing loss. It will result from the inner ear or auditory nerve dysfunction. When the auditory nerves, sensorineural means when there is a auditory nerve dysfunction takes place, that is in 8th cranial nerve or the brain, then it will leads to a hearing loss, because the sensory nerve will carries the impulses from the ear to the brain and from the brain to the ear. Then only we can able to hear the sounds. But when the sensorineural hearing loss, in case of sensorineural hearing loss, when the auditory nerve dysfunction takes place, it will causes the hearing loss. What are the causes for the damage to the auditory nerves means congenital or hereditary factor, noise injury, use of ototoxic medications like gentamicin, etc., aging and degenerative process, ototoxicity, Meniere's disease, and systemic disorders such as autoimmune disease, syphilis, and diabetes mellitus. These are the some of the causes which will cause us a auditory nerve dysfunction. Next, moving on to the mixed hearing loss. In case of mixed hearing loss, here we can observe both the causes will be there. Okay, like a conductive hearing loss as well as sensory nerve dysfunction. Both the causes will lead to a hearing loss. Next, based upon the severity, the hearing loss will be, or deafness will be classified like mild, moderate, moderately severe, severe and profound. In case of mild, the person will be unable to listen or hear the voice in a 26 to 40 decibels. But above the 40 they can listen, they can hear. But below like a 26 to 40 decibels, the person will be unable to hear. Okay, the normal frequency will be 25 decibels. But in case the person is unable to hear for 26 to 40 decibel means we will classify it as a mild hearing loss. If it is 40 to 55 decibels means moderate hearing loss. Okay, below to 40 and 55 the person is unable to hear, but above 55 the person can hear. So for those person we will call it as a moderate hearing loss, and moderately severe 56 to 70 decibels. Next, in case of severe 71 to 90 decibels, and in case of profound 90 decibels and more. Even for the 90 decibels and more the person is unable to hear, then we will call it as a profound hearing loss. Based upon the onset, the hearing loss will be classified like congenital and acquired. The deafness occurs at a birth itself, that is called as congenital, and acquired, the deafness occurred after the birth, is called as acquired. Next, other types like unilateral and bilateral. Unilateral is nothing but single-sided deafness. We will call it as a SDD, single-sided deafness. Means either may be right ear or else may be left ear. Any one ear there will be a deafness, but another ear the person can listen, hear. That is called as unilateral. And while bilateral, both the ears will be affected and both the ears will be having a hearing impairment. Next, what will be the clinical manifestations or as signs and symptoms means the person with a hearing loss will have a gradual and goes unnoticed by the client. Okay, the hearing loss will be there like a gradual process and it is unnoticed by the client itself. The person with a hearing loss will be having a communication problem because the person will tell something, they will listen something and they will respond something. If you are asking what's your name means they may ask what you are asking, I didn't hear properly, like that they will respond, means communication problem. Failure to respond or to oral communication, inappropriate response to a oral communication means from where had you a breakfast means they'll tell their name, my name is so and so, like that. So inappropriate response. Excessively loud speech because they will be having a hearing problem, no, so they will be speaking loudly. Abnormal awareness of sounds, strained facial expression, constant need for clarification of conversation, listening to radio or TV at increased volume. These are the some of the signs and symptoms of hearing loss. Diagnostic evaluation includes history collection, physical examination. In the history collection, we need to gather regarding the family history as well as past medical history, because the past medical history plays an important role, that is ear related disorders like if the person is having any otitis media or any other ear related disorders previously, that we need to gather it. Next, physical examination includes Renin test and Weber's test. These tests we are going to do to identify the hearing ability. Next, audiometry, auditory brainstem response, tympanometry and evoked otoacoustic emission test. These are some of the diagnostic evaluations. Next, moving on to the management. The goal of management of the client with hearing loss are to restore the hearing, to assist the hearing and to manage the tinnitus and implement oral rehabilitation. First, to restore the hearing. See, as I mentioned you in the first as I mentioned you starting itself, the hearing loss mainly due to the blockage. Okay, so when we are treating the blockage, when we are treating the infection, when we are withdrawing some of the drugs, then it will leads to a restore of hearing. So only we have to administer the antibiotic for any infection, and in case of sudden hearing loss, administration of oral corticosteroids will help to restore the hearing. Then assess the hearing. Unfortunately, most hearing losses are permanent and hearing cannot be restored. So, we need to assess the hearing. The use of hearing aids and assistive listening devices can greatly improve the client ability to communicate and interest with the others. Early detection and interventions are crucial to minimize the impact of hearing loss on the child's development and educational achievement. So, we need to diagnose the early and we have to start assisting the hearing. In infants and young children with a hearing loss, early identification and management through the infant hearing screening program can improve the linguistic and educational outcome of for the children. Okay, so in case of children and young infants, it is very important that we need to identify the hearing loss early. The parents plays an important role to identify the early in case of hearing loss. So, what will be the benefits means, because when we are identifying the early, then the child's language as well as educational outcome will be good. If we are not identifying the early and if we are leaving, then the child is unable to learn the linguistic as well as the education. Oral rehabilitation. Okay, so oral rehabilitation is a process of identifying and diagnosing a hearing loss, providing a different types of therapies to the clients. Okay, so what are the different types of therapies means, like a language developmental therapy, speech therapy. Okay, and also along with the therapies, we are going to implanting a different amplification devices to aid the client's hearing ability. We'll see now. Hearing aids, that is called as behind the ear. We will call it as a BTE, means behind the ear hearing aids. You can observe in this picture. See, behind the hearing, behind back of the ear, there is a hearing aid is there. That is called as behind the hearing aid. These consist of dome called an ear mold and a case. Okay, this hearing aid consists of dome as well as, see here, this is called as a dome. Okay, this is called as a dome, as well as there will be a case with a connection linking to one another. The case sits behind the outer ear. You can see this. See, this is called as dome. Just observe my arrow mark. This is called as the dome and this is called as a case. So, the case will be placed behind the ear. See, back of the ear we have placed the case. So, the case sits behind the outer ear with the connection to the dome coming down the front of the ear. The sound from the device is either electrically or acoustically routed to the ear. Okay, the sounds which are coming from the outside, that sounds will be transferred to the, like the case will be transferred to the dome. The behind the ear hearing aids tends to last longer than other devices as the electrical components are located outside the ear. Comparing to other devices, the BTE will be present for a longer time. Okay, because there will be less moisture and a earwax damage. These devices are more popular with the children who need a steady and easy to use a device. Next, in the canal, that is called as ITC hearing aid, means in the canal. This fills the outer part of the ear canal and can be seen. Okay, we can see this and it will fill the outer canal. You can observe here, inside this we have placed. Okay, usually it is made up of with a silicone. Okay, and use it to position the loudspeaker inside the ear. These devices fit most patients straight away and have a better sound quality. Next, completely in the canal. See here, in the canal. Okay, in the canal and outside we can see. That is called as in the canal hearing loss. Hearing aid. Completely in the canal means completely inside it will be there. We can't able to see outside. Means through the just one look we can't able to see. These are very teeny, discrete devices but not recommended for the people with a severe hearing loss. Bone conduction hearing aids are there. These assist the people with a conductive hearing loss as well as those who are unable to wear the conventional type of hearing aids. The vibrating part of the device is held against the mastoid with the headband. The vibrations go through the mastoid bone to the cochlea and the person can able to hear with these devices. Next, moving on to the tips for using a tips for hearing aid care. Okay, how to care the hearing aids. Cleaning. The ear mold is only part of hearing aid that may be washed frequently. Okay, the electrical part we should not wash it. Only the ear mold we need to wash it. Wash the ear mold daily with soap and water. Allow the ear mold to dry completely before it is snapped into the receiver. Clean the cannula with a small pipe cleaner like a device. Okay, clean the cannula with a small pipe cleaner like device. Proper care of the ear device and keeping the ear canal clean and dry can prevent complications. Next, malfunctioning. How to care the malfunctioning means inadequate amplification, whistling noise, a pain from the mold can occur when a hearing aid is not functioning properly. So, we have to identify if there is a inadequate amplification and a whistling noise is there, means it indicates that hearing aid is not functioning properly. So, immediately the person has to go to the doctor and they have to change the hearing aid. And frequently check the malfunction of the hearing aid. And is the switch on properly or not, we have to check it. And the battery is charged or not, we have to check it. And we have to, if the hearing aid is still not working properly, notify the hearing aid dealers. Next, moving on to the prevention of hearing loss or deafness. How to prevent means a primary prevention, secondary and tertiary prevention is there. Under the primary prevention, the main aim of primary prevention is to minimizing the risk from trauma, noise exposure, use of ototoxic drugs and infectious diseases, because these are the causes for the hearing loss. So, when we are minimize these causes, automatically we can minimize the hearing loss. So, education to the community and awareness program to the general public regarding the causes and use of protective instruments and the way of prevention is very important to prevent the hearing loss, because the protective instruments includes wearing the helmet when they are going in the vehicles, and wearing the helmets when they are in the sport, because head injuries and some of the trauma is the cause for the hearing loss, no. So we have to use a protective devices, and it is very important. Immunization will prevent the hearing loss, because one of the infectious diseases like measles, mumps are also cause for the children to go for the hearing loss. So immunization over a certain drugs will prevent the hearing loss among the children. And taking care during the occupational or industrial works, okay, because the workers, those who are working in occupational and industrial noise, okay, high noises, they may prone to get the hearing loss. So only certain measures has to take to prevent excessive exposure to the occupational and industrial high level of noise by wearing the ear plugs and avoiding a prolonged exposure to the noise. Periodical health checkups is very important, and it is for the occupational and industrial workers, those who are working in a high noise levels. And avoiding of certain drugs which will cause us the ototoxicity, we need to do to prevent a hearing loss. Next, secondary prevention. It involves early detection of hearing impairment through the screening and referral after any ear problems. And tertiary prevention. Tertiary prevention focuses on maintenance of optimal function through a hearing rehabilitation program. Proper use and care of hearing aids and implementation of coping, and promptly notify the physician. So far we have seen about what do you mean by hearing loss, what are the causes for the hearing loss, and what are the management we have seen, okay, and also some of the hearing aids we have seen. I hope all of you understand about the deafness and hearing loss. Thanking you.